Okay. Hello, good afternoon. On behalf of Hetero Healthcare, I, Dr. Prashant Khandeparkar, welcome to you to this webinar on intimate hygiene. Doctors, as we know, with the changing lifestyle, the disease patterns are also changing, and today intimate hygiene is becoming a very important issue. At Hetero, we market products in multiple therapy areas like gynecology, dermatology, gastropulmonology, ortho, etc. We have a very strong R&D backup, which is why we try to develop products keeping patient benefit in mind. Our endeavor is to improve patient compliance and ultimately clinical outcome. We have developed NSAID patches, reverse treatment patches for patient compliance so that the chance of dropouts are less and possibly patient outcome is better. Gynecology, obstetrics, and IVF is an important therapy segment for us at Frenza. Apart from oral tablets like Didropal and Milotin, we market products for vaginal health like Feminora and Pelitra. Recently, doctors, we have introduced a vaginal film under the brand name Celero. The film contains lactic acid along with fructooligosaccharides. The film is supposed to correct vaginal pH and maintain it at an acidic pH so as to protect vagina from infections. To speak more about vaginal conditions requiring vaginal film, product, and share clinical experience, I have pleasure in inviting Dr. Lavanya for today's webinar. Madam has 8-year experience in obstetrics and gynecology. She has conducted more than 1,500 deliveries, 1,000 cesarean sections, both abdominal and vaginal hysterectomies. Madam has managed various emergencies like eclampsia, PPH, abortion, bleeding, etc. Dr. Lavanya has attended various club meetings and has conducted several awareness campaigns. Madam is trained in sonography. With this, I hand over the session to Dr. Lavanya. Madam, all yours. Thank you.
Thank you, sir. So, I myself, Dr. Lavanya, working as an obstetrician gynae consultant at Mother Hospital and IVF Center in Hyderabad. Today, we are here to discuss a few recent advancements in the intimate health management. So, what does this intimate hygiene. So what does intimate hygiene represent? So intimate hygiene is all about keeping your privates clean and hygienic. That is, a daily gentle cleansing of the vulva is an important aspect in the feminine hygiene and the overall intimate health. So what is vagina? So vagina is nothing but it is a self-cleansing machine. So normal vaginal discharges, which are clear white vaginal discharge, which indicate that female vagina is perfectly healthy. Now, when the discharge becomes smelly or foul smell, or there is a difference in the change of the color of the discharge, like it becomes yellowish green or a curdy in consistency, which is associated with a few symptoms such as itching and soreness, the chances are high that it might be due to an infection. So what does the vaginal flora and the vaginal pH? So vaginal flora and the vaginal pH plays a significant role in the intimate hygiene. So coming to the vaginal flora. So vaginal flora is vaginal microbiota or the vaginal microbiome. They are nothing but they are the microorganisms that colonize the vagina. So in a healthy vagina, both good and bad bacteria coexist in balance. The primary bacteria of a healthy vagina are of the genus Lactobacillus. As we all know, the Lactobacillus is a gram-positive bacteria with a rod-shaped Dodderlin's bacilli. That is nothing but a Dodderlin's bacilli. We call it as a lactobacillus. This lactobacillus protects against pathogenic species. Now the vaginal pH. What does the vaginal pH indicate? A healthy vagina is almost equivalent to a balanced pH. So the normal vaginal pH ranges between 3.5 to 4.5, which is an acidic pH, which protects the vagina from other organisms. So then increased acidity forms a natural protective shield to prevent harmful germs and other microorganisms from intruding. So a pH above 4.5 makes the vagina susceptible to vaginitis. That is nothing but the inflammation of the vaginal tissue. The lactic acid supports the maintenance and the restoration of this naturally healthy vaginal flora. Thus, the vaginal pH is therefore determined by the sum total of the lactic acid production by the vaginal mucosa and the microbial flora. So how does this lactic acid get produced? So the production of lactic acid is in turn dependent on the female hormone, that is the estrogen. Under the effect of the estrogen, the superficial squamous cells of the vaginal epithelium containing glycogen gets converted into lactic acid under the effect of these lactic acid bacteria, which favor the colonization of the lactic acid bacteria, hamper the growth of the pathogenic bacteria, creates an acidic environment. Thus, the natural protection system prevents infection and maintains a vaginal health. Now, this increased acidic pH, what does this do? This hampers the growth of the pathogenic bacteria, colonizes the more lactic acid bacteria, induces the more lactobacilli growth, thus creating an acidic environment of the pH of 3 to 4.5, and thus regulation of the vaginal pH. Now, thus the normal vaginal flora with the acidic vaginal pH and the vaginal discharge. These are all the components of an innate defense mechanism that protect against vulvovaginal infections. Now, coming to the pathophysiology, how does this vaginal health gets disturbed? So there are a few risk factors like the age, that is in the pre-pubertal age group or the postmenopausal age group, where there is a deficiency of estrogen, and few lifestyle changes can all lead to decrease in the vaginal lactobacilli, thus leading to decrease in the concentration of hydrogen peroxide or the lactic acid, which is responsible for the acidity of the vaginal, thus leading to a raised vaginal pH, increase in the overgrowth of pathogens, finally leading to the vaginal infections, that is the vaginal discharge, fishy odor. All these finally lead to infertility and subfertility. So what are the symptoms generally the patients present with? So there is a strong fish-like odor, a greenish or a foamy curdy white vaginal discharge, itching around the vagina, or a swelling or irritation around the vagina, with a pain or burning feeling in the vagina during coitus, that is nothing but they present as dyspareunia, burning sensation while urinating. So now what are the general causes of this disturbed vaginal pH? So the general causes is menstruation. So menstruation, a blood has a pH of 7.4. This high pH will favor the growth of other microorganisms leading to vaginal infection. And the medications, the antibiotic medications, as they are used to kill the bad bacteria, simultaneously they will kill both the good and bad bacteria, which lead to rise in the vaginal pH. And few birth control pills can also lead to changes in the vaginal pH, which potentially lead to infections. And use of douching method, which is a cleaning method of inside the vagina. Few people can use this frequently, because of which there is a raise in the vaginal pH. Finally, that leads to infection. And use of lubricant gels to reduce the vaginal dryness during sex. Some lubricant gels have a higher pH of more than 4.5. Thus, this high pH can lead to vaginal infections. And a few conditions such as breastfeeding or menopause, as we all know that estrogen plays a large part in keeping the vagina healthy and the pH acidic. When women breastfeed or start menopause, these estrogen levels are going on the lower side. This hypoestrogenic state leads to vaginal atrophy, leading to higher pH and vaginal infection. What are the current treatment guidelines? What we have to treat all these vaginal infections is the antimicrobial therapy. As we all know, there are many group of drugs like clotrimazole, miconazole, turconazole, fluconazole, metronidazole, ketoconazole, whatnot. Every drug is used as in the form of cream or insert or the oral drugs for a longer duration. So what all these do? Although they cure the infection, but disturb the vaginal flora, leading to recurrences, and there is an untreated root cause. Now, these available therapy options don't give any long-lasting results. So now, what are the current treatment and the need gaps? We all know there are lactic acid washes, suppositories, vaginal gels, and capsules. So each one have their pros and cons. So when we use a lactic acid wash, they wash out even the good bacteria and they lack the adherence to the vaginal surfaces. Suppositories, there is a lot of leakage issues and patient is very inconvenient to use the suppositories. Vaginal gels, it is a messy application and accurate drug delivery is not possible because of the sticking of the gel to the hands or the applicator. And soft gel capsule, patient discomfort, and there is a non-flexibility of the material. So all these have led to a new intervention, that is a need for a right therapy option for a sustainable results in balancing this vaginal pH. Now what we have is the newer therapy, a read for revolutionary therapy, that is nothing but the lactic acid vaginal fillings. So now what are the advantages of these vaginal fillings? So they have a longer residence time due to the use of bioadhesive polymers. There is a lack of leakage concept and patient comfortability due to the film flexibility. and it is easy to store. They have an increased stability even at the extreme storage conditions, a faster drug release, and a convenient application, which is more important. So now Hetero Healthcare has introduced first time in India a revolutionary therapy in the vaginal care management to balance the pH, to bridge the therapy gap, which knows the best and offers the best. That is nothing but our sclerovaginal films, which is a lactic acid vaginal film which work for the healthy vagina in many conditions of vaginitis, including bacterial vaginosis and vaginal candidiasis. So what does this Celero contains? So Celero contains the lactic acid, which restores the imbalance of the vaginal microbiota, thus restoring the vaginal pH, and it contains the fructooligosaccharides, which promotes the growth of lactobacilli and secretes the antibacterial substances, thus balancing the vaginal pH. Now, this revolutionary formula of lactic acid for the maintenance of the vaginal pH, for the first time in India by the Hetero Healthcare, is a Celero lactic acid vaginal film, which has a fast and accurate drug delivery and a longer adherence to the vaginal surface due to bioadhesive polymer, and a flexible firm ensures the patient comfort, which is easy to carry, easy to use, and easy to store. So now instructions for its use. It is very easy to use the Celero films. So first, as you all know, patient should wash the hands first, followed by patient should cut the film from all the four sides. Then just patient should roll the film on its dry fingers. Just patient should be in a comfortable position, preferably before going to bed after emptying the bladder. Just insert the film into the vagina. Then followed by patient should wash the hands after insertion. Thus, the Celero-vaginal film is a simple dosage of one thin film at bedtime for a period of 5 to 7 days. So, any queries are welcome.
Thank you very much, madam. We do have several queries coming in. I will ask them one by one.
Sure.
First is, there's one question. How safe is intimate hygiene care during early pregnancy?
Yeah, it's very safe, because what we are giving in the Celero-vaginal film is only the lactic bacilli. Lactic acid bacilli is a normal vaginal flora, which every female contains. So this can be used very safely in pregnancy, even from the first trimester of onset till the last trimester. It can be used.
And at what stage in the infection you actually use the film? Like when the patient is predisposed to the infection, or when the patient has actually got the infection or at risk of infection? At what
So
stage?
there are a few things, like if patient already had an infection, so followed by the antimicrobial therapy or the vaginal therapy, what you are preferably we were using for all these days, followed by this therapy to prevent the recurrences, we can continue the use of the lactic acid vaginal films. And few people during menstruation or immediately after menstruation, they suffer from the symptoms of this vaginitis. So few people will be able to handle this, but there are many people, especially because of these lifestyle modifications, it is very messy to use pessaries post-menstruation and all. So in those people, it is better to use the lactic acid vaginal films. For a few months, they can try it after menstruation and they can see the change, because it is the normal lactic acid bacilli, which is generally required for the normal vaginal flora to flourish.
So more questions come. How common is vaginitis when pH? There are so many causes which can lead to increase in pH. How common is what the prevalence of vaginitis in those cases?
So it's almost like very common. We can see every 1 out of 4 patients running into the OP will have one or the other symptoms of vaginitis, but it is the patient like to come out of it, because as it is a very sensitive issue, people coming to a gynecologist, so people will try to ignore it. People will try to just ignore the symptoms, like some vaginal itching, soreness. They're not worried unless it becomes like flourished. The infection gets flourished, then the people will consult a gynecologist or they'll seek for a medical advice.
Okay. Do you use it with active treatment?
We can use. There is no harm in using a combination therapy. When we are using a oral antimicrobial therapy, we can use a vaginal lactic bacilli form.
Is this vaginitis common in diabetics in patients on OCs, oral contraceptives?
Yeah, that is more common, because vaginitis, what we say, there are cases where we have seen people coming with recurrent vaginal infections. When we go back and get the investigations done, people have been diagnosed as de novo diabetic. So why this recurrent vaginal infection at this age group? Why after treating so many times, why this is getting recurrence? We thought and we went back and got the investigations done. Then it came out to be as a de novo diabetic, which is uncontrolled.
Yeah. I mean, it's like urinary tract infection, the recurrent urinary tract infection.
Exactly.
Even with OCs, this thing happen. Patients on oral contraceptive.
Yes. Oral contraceptive pills, any pills, whatever antimicrobials or pills, whatever we are using, they disturb the normal vaginal flora. Because as we all know, when we take an antimicrobial drug, as they are going to kill the bad bacteria, along with that, even the good bacteria will be killed. So and sometimes we need to add a probiotic along with the antimicrobial. In the same way, when we are using the OC pills and all, we can use it as a probiotic.
A very interesting question. No? How do you know that patient is responding?
So it's only the patient should be able to tell. So because we see patients coming recurrently. Once the patient is disappeared from the OP clinic, it means they got cured.
Generally, for how many days you prescribe? 5-7 days?
Generally, I prefer giving it at least for a period of minimum of 5 days, maximum of 7 days. So 1 week would be sufficient, I think.
And one question, we recommend generally that to use this film at bedtime. Would it make difference if someone uses it in the daytime instead of bedtime?
It's not like you can't use it in the daytime, but the patient feels comfortable whenever we are using some vaginal films or vaginal suppositories, anything like at bedtime would be according to patient convenience. The people who are working at night times can use, but it is only during sleep. I mean, before they are going to sleep for a period of 3 to 4 hours, it would act better without disturbance.
But therapeutic effect wise, because at night when the lady uses it, she's sleeping. She's at
no. Therapeutic effect wise will be the same whether they use in the daytime or in the afternoon or nighttime, irrespective of the daylight.
These vaginal washes which are available today, do they irritate the vaginal lining by any chance?
Exactly. The marketing has become in such a place, the vaginal washes, like what they want to wash exactly, I don't understand. So they are washing all the vulval area and the perineal area. So what we are supposed to clean is the vagina. Yes, vagina, they are having the issue with the vagina. What is the purpose of cleaning the vulva and the perineum? That's right. Is of no use.
That's very cool. And does it interfere with post-delivery episiotomy?
No issue. No post-delivery. It doesn't have any type of contraindications or the side effects, I don't think.
And see, I don't know, this is a very technical question. If the pH is raised, which is the infection most likely to catch, bacterial or fungal?
To say bacterial is more common comparatively.
Gardnerella or trichomonas?
Yes, Gardnerella vaginalis is more common. Trichomonas vaginitis is more common. Fungal infections, preferably when it is a moisture-associated issue or a diabetic underlying condition, have more chances of fungal infection. That is Candida.
And suppose if the lady has got fungal infection, some other patient has got bacterial, would therapy make a difference? Would this be better effective in Candida or better effective in bacterial, something like that, or it's same?
No, it can be used in the both. There is nothing like we are not using any antibacterial or an antifungal substance. What we are using is the drug is lactic acid bacillate. That is the normal colonization of the vaginal flora with the lactic acid bacillate.
That is the natural way of
natural way of restoration of the vaginal epithelium.
Correct. One minute, I'm just seeing one question has come. Is this type of raised pH very common with menopause?
Yeah, exactly. Post-menopausal, there is a hypoestrogenemic state.
Correct.
So only under the influence of estrogen, the squamous epithelial cells of the vaginal epithelium containing glycogen, the lactic acid bacilli require to convert this glycogen into lactic acid to increase the pH, thus preventing the vaginal infection. In menopause, under low estrogen states, obviously, there is low amount of glycogen, low lactic acid bacilli production, lactic acid levels will be on the lower side. Automatically, they are more prone for vaginal infection. It is only leading to...
And in case of breastfeeding?
Breastfeeding is also the same. So post-delivery, estrogen levels will be on the lower side.
Drop.
So hypoestrogenemia is the main cause.
But during breastfeeding, you would use this. There is no.
We can use. There is what we are giving is nothing like that will be excreted through the breast milk. Why we don't generally give drugs during breastfeeding is they get excreted through the breast milk, and that may be harmful to the baby. So, but this lactic acid vaginal films, first of all, we are using as a topical films.
Absolutely.
So there is no role of it getting absorbed into the systemic circulation and excreting into the breast milk and harming the baby. No risk.
It's a natural way of developing.
Yeah.
Because if I were to ask you a place of importance amongst menopause, diabetics, or breastfeeding or oral contraception, which is the most common thing which will come to your mind for this type of?
Most common? Not it.
No, out of breastfeeding, out of menopause, out of oral contraceptives or diabetics, this infection would be very common in first 1, 2, 3, 4, if I were to say.
So actually to say post-menstruation only it is most common because the reproductive age group female.
About menopause, post-menopause.
Yeah, postmenopausal also is common. But postmenopausal females, generally they in our country especially, they don't seek much medical advice. That is the main problem. So in a diabetics, the recurrence is very common. We see people getting treated multiple times. Every alternate month, they visit gynecological clinic just for vaginal infection.
Goes up, infection comes in.
So that's what we try to tell them, that please try to control your blood sugars first. Once your sugars get under control, automatically your vaginal infections will be under control.
In the meantime, something has to be given. Yeah.
Exactly. So
say something else. Madam, it was wonderful interacting with you. We got insights into so many questions.
Thank you.
As of now, I think these are the only questions. If there are some more questions, we'll come back to you.
Sure, sir. And I thank Hetero for giving me this opportunity. I thank one and all.
Yes, and it was wonderful
for making me a part of Silero.
The one thing that's come.
Yeah.
Patient feedback about this film? It's easy to use.
Patient feedback, just recently we have introduced it in India and we have started it. So the feedback should be, I personally started with few patients, but they didn't turn up back. Once means they have got cured. I am happy for that. They didn't see me. Once they come back, surely I will find out. So I think there will be a positive feedback with the Silver film.
Because no news is good news.
Yeah, exactly.
Thanks so much, madam. Thank you.
Yeah, thank you, sir. Thank you so much.
Why she want to? Okay. She'll be there. Thank you.
Hello.
Hello.
Yeah, hi, doctor.
Yeah. Hello, Barisha.
Thank you so much.